your health watch, the measles outbreak in the upstate continues to get worse. State health officials confirming more than 100 new cases since late last week. Now the Department of Health saying that the outbreak is reaching into the Midlands, confirming a person visited the State Museum in Columbia while infectious this month. Our Bradley's Pimentel has been tracking that. Bradley's, what can you tell us?
According to state health officials, a person with a confirmed measles case visited the museum January 2nd. Museum staff tells me more than 900 people visited the museum that day. Health officials say the people that were there could have been exposed.
It's wild. I didn't even know that. Yeah, I'm trying now to recall if I got a measles shot for her, but yeah, it's crazy.
Jonah Dearman visiting the State Museum with his daughter Wednesday afternoon. He says he just learned someone went to the museum with confirmed measles earlier this month. According to the Department of Public Health, the state now has 434 measles cases with 127 new cases just since Friday.
In DPH's investigation of the new cases, a person with confirmed measles, we have learned, attended the South Carolina State Museum in Columbia while infectious.
According to state epidemiologist Dr. Linda Bell, the rapid increase in cases is likely from holiday gatherings and travel.
People should be aware that the person did not know they were infectious at the time of the exposure. They were an upstate resident, and we still have not had any confirmed cases of measles in any region other than the upstate.
Bell says people who visited the museum on January 2nd who are not vaccinated could start developing symptoms now. The State Museum reported 957 people attended the museum that day. Symptoms include things like cough, runny nose, red watery eyes, fever, and rash. Columbia pediatrician Deborah Greenhouse says it's important for everyone to get vaccinated.
It's a very effective vaccine for a very serious and incredibly contagious disease.
Greenhouse says as a pediatrician, many parents may question whether the measles vaccine is safe and if side effects should be a concern.
If you look at the overall benefit of the measles, mumps, rubella vaccine versus the very small risk of usually incredibly minor side effects, it becomes a very easy decision.
Greenhouse says once measles is in the community and a child is unvaccinated, the likelihood of catching it is high.
If you have 100 people who are not vaccinated in a room and one person with measles comes into that room, 90 of the 100 unvaccinated people will catch measles. Of those people who catch measles, of the children who catch measles, 15 to 20% will end up getting sick enough to be in the hospital. 1 to 3 out of 1,000 will die from the disease. This is not a minor illness.
The Department of Health and Dr. Greenhouse are encouraging everyone to get a measles vaccine. If you believe you've been exposed or have symptoms, contact a healthcare provider before going to a facility. Live in Columbia, I'm Bradley's Pimentel, Watch Fox News, Local First.